This week on Health Garage.
What's the use of an ambulance if you don't have the qualified people?
Emergency care is a neglected area in Uganda, yet a very important area that we need to improve.
What's the use if we put in an ambulance very complex medical technology and you don't have people that can operate the vehicle?
The biggest problem we have right now after HIV, AIDS and TB is road traffic accidents. They are claiming a lot of lives, and emergency care has to be improved to make sure we save all these victims of trauma.
In Uganda, emergency care remains a neglected yet vital aspect of health care. Road traffic accidents have become a major public health concern, claiming numerous lives daily. The current state of emergency response is alarming, with injured individuals often transported in trucks, motorcycle, or substandard vehicles lacking proper medical equipment and care. Furthermore, Ugandans have not embraced the 911 emergency number, excavating the situation. Today, we delve into the critical issues surrounding emergency care and ambulance standards, joined by experts from Life Medical Rescue International. Join us on this important discussion and subscribe to our channel for more insightful content. Welcome to Health Garage.
I am Dr. John Baptist Senyondwa. I'm a surgeon by profession. I am also the medical director of LIMEA, which is Life Medical and Rescue Services in Uganda. LIMEA, what do? We are an emergency medical service provider company, a private company, and our services range from offering medical dispatch and transport of critical patients from one hospital to another, from a scene of injury, accident, fire, any trauma scene to the hospital. But also there are events that we know are high risk. Sports activities, for example, it's a rally, it's a rugby. We also cover medical cover for those services. We have also community engagements. We have Sigma units we can deploy and do a mobile hospital in case of natural disasters, volcanoes, earthquakes, all those events that require emergency medical cover. That's our area of specialization. Yes. So the reason why we set foot as LIMEA to impact Uganda was in response to a gap. As you know, when there's an accident that happens, for example, on the road, evacuation of these people is very, very difficult, one, and also time. Time is a very important thing, because if you miss 2 minutes or you delay by 1 minute, it can change the difference between life or death. And that's a gap we realized. So the way the patients, the way the victims are transported is very not yet ideal. The time to respond to these occurrences is also still lacking, and also the personnel that respond to these events is also lacking, because if you got an accident, God forbid, on the road, the first person who's going to come to you is your neighbor, and they probably don't know what to do. Their instincts are going to tell them, drag her out of the road such that traffic can move on. If the policeman comes, it's going to be the same response. But you probably need care at that time to save your life or to prevent a disability from becoming worse. So that's where we came in. That's the gap we want to address and save more lives, improve people's lives in Uganda. That's the gap we're trying to solve. Yes.
We've seen accidents or occurrences injuries on the road, and the first thing that people do is to get their phones to capture what is happening. Does that signal anything as a country? Are we not educated? What's wrong with us?
So you bring out a very good point. Anything that results in casualties, the first response usually is to ensure your safety, definitely. But then you call for help. That's the algorithm, that's how it goes. So when you call for help, you're supposed to call a medical dispatch or police or fire in this case. So for accidents, most times Ugandans will record. They record it, and it's good to record, but it doesn't save that person's life. So what we encourage people is you call. We have a dispatch number that you can call, and someone receives the call, processes the call, and sends a team of paramedics, doctors, or the team that you require to that scene. And the reason why we do it that way is sometimes at the site of the scene, you can do some processes, maneuvers that can save that patient's life. Other than just carrying them, putting them on what we see is routinely they're picked up, put on a truck or something and rushed to the hospital. But in that process of picking up someone, putting them on a truck, rushing them to the hospital, you can actually end their life, or you can further worsen their disability. For example, if someone has a fracture in the neck, the spine, if you just change their neck like that, you have already severed their spinal cord and you've changed the injury. So that's why we like or encourage the medical people be the ones to evacuate that victim from that scene, which is an area where in Uganda, as you know, is still very, 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 very lacking. So these are the areas we are trying to cover as LIMEA. Yes.
In 2020, we were faced by a pandemic.
Yes.
And how did you respond to that? And how was Uganda's preparedness in that time?
Well, definitely we all remember the pandemic. It caught us by surprise. We were unaware, we were unprepared. I can't say everyone was prepared for it, but what the beauty was how we responded to it. We had so many cases, patients requiring extra care that we normally never had to provide. Ventilatory support, transporting of victims from home to hospital. And during that time, LIMEA, we actually picked during that time. We did a lot of responses and evacuations, as well as in-hospital transfers of patients from one unit which don't have what we call the referral system. If you are in a hospital that doesn't have an ICU, but you require an ICU, you can be referred and transferred from that hospital to a hospital with the ICU, and you meet your needs in that hospital. We did a lot of that. But also, you know that it was a crash program. Sometimes we had to run this ambulance as the ICU. We had some patients that were resuscitating within this same ambulance. So these are areas that we dived into the pandemic. And the pandemic also showed us how much we needed this critical care, the specialized care, leave alone what we've always cared about, malaria and all that. Now you need care that is super specialized. And those are some of the gaps that LIMEA has tried to dive into and offering, like for example, a mobile ICU. If you needed a mobile ICU right now, we can set up one for you. Of about 10 beds, we can set it up for you. Back then, it wasn't an area that was, developed, but now we can do that with ease. So this is all because of the pandemic that we are actually where we are right now in advancement of healthcare, and we hope to go a little bit higher in advancing this healthcare and ensuring that all Ugandans can have access to this quality healthcare. So the LIMEA VAS partnership, it's important in the process I've told you. How do we move, or how do we advance the quality of care but also the complexity of care that we provide. As you know, traditionally ambulances were vehicles that move a patient from one place to another place. But right now, ambulances are vehicles that offer treatment and resuscitation of a patient from one place to another. That's an advancement in care. So the VAS Limea partnership provides us that capability. If we get newer vehicles, newer equipment with accessibility to all areas of the country, because we have urban areas, but we also have rural areas, hard to reach areas, remote areas that require 4x4 trucks, that require a different sort of an ambulance that can't skid on the road. And the VAS Limea partnership dives into that. If we get 4x4 trucks that are as sophisticated as this ambulance, an ambulance that you can have a ventilator, a patient on a ventilator, a patient being monitored at all times of the transfer, and ensuring that the care they get on board of that ambulance is up to standard. It's what we hope to obtain from this partnership. Another thing that we hope to obtain from this partnership is widening the scope of our coverage, because we all know that healthcare routinely is based in urban areas. But what about the rural areas? We need to reach those areas as well, because they have a right to healthcare. So this partnership extends us further into that realm of healthcare for all people, irrespective of where you are, urban or remote.
You're watching Health Garage.
It's VAS. It stands for Wiedmarscher Ambulanz- und Sonderfahrzeuge in German. That means Wiedmarschen is the town where the company was founded. And Ambulanz are ambulances, and Sonderfahrzeuge are special vehicles. Because apart from ambulances, we also build mobile clinics, disaster relief vehicles, which are not necessarily ambulances. The bond is actually the product. Because Limea, before he was active here in Uganda, he was in Europe. And in Europe he had an experience at an injury, and he was brought to hospital, and there he was in a VAS ambulance. And that was the original bond. And then after he came here to Uganda and established his private ambulance organization, he purchased used VRS ambulances, and in the close cooperation with us now, we specially developed a vehicle for the needs here of Uganda and also neighboring African countries, and that's the result that we are presenting here today. The specialty about our company is we don't have 3 or 4 catalog standard ambulances. But we go into the countries, talk to the people, because what's the use of an ambulance if you don't have the qualified people? Let's start with that, very simple. What's the use if we put in an ambulance very complex medical technology and you don't have people that can operate the vehicle? And that's why we always go into the potential customers and what do you need? What are your plans? And we specially make the ambulances for that customer. But always looking 5-10 years ahead that any advancements can be incorporated. That's a totally different approach than other companies are doing. And therefore, it all depends on the emergency medical system that's used. Also in Germany, in the past, it was more like a UPS, it was more transporting a patient as fast as possible from scene to hospital, but that changed, and that's why you have more and more medical equipment inside. You first take care of the patient, you stabilize the patient, you comfort the patient, and then you decide, where do we go? To this hospital or to that hospital, which is maybe specialized on spinal injury. Then you go to the hospital for spinal injury. If it's a burn, maybe you go to a burn special hospital and not just to any hospital.
Okay, from this interaction I've been made to understand that these ambulances are tailored on a specific need.
Yes. They are tailored to the need for this application of this ambulance in Uganda. We were beginning of the week also in Rwanda, for where you have very rural areas, where you have very tough roads, difficult roads to get. And this is an ambulance, for instance, which is also adjusted to the service capabilities. You will, apart from medical equipment, you have no electronics in this car. The base vehicle has no electronics in the engine. It's a very sturdy 6-cylinder diesel engine. And we use in the control of our ambulance also relays, which every electrician anywhere can replace. You don't need any computer to program it. You can still do it as an electrician. And then if you have a problem, just go to any electrician and he can repair. That's very important. And we also have service partners that are trained to keep the vehicles running, because we have seen in so many African countries, very often 100 ambulances were bought. Somebody bought them and they were delivered and they were commissioned, and very often you see 20, 30, half a year later sitting in the corner, no service, nobody takes care of them. And that's what we have to do different, that's what in our approach we have. But Limea has a similar approach to that. There we are on one mind. There's also a combining element between the two companies. Yeah, the common element is certainly a stretcher that you have in every ambulance, whether it's a very simple one or very, very sturdy ambulance. This is a Toyota Land Cruiser. I think you all know ambulances, Toyota Land Cruiser as a van. Yeah, then you have to sit in the back, and it's a very crowded, congested vehicle. And here we have a Land Cruiser, and we put a box on the back. It's the same width, it's a little bit higher, and the advantage is that you have inside much more space for medical equipment, and also if you have the patient in front of you, you have headroom, you can properly work on a patient. And that's the specialty about this vehicle, which is new. Land Cruiser ambulances you have already in many countries here. Blue lights, stretcher, a little bit of oxygen, a little bit of Band-Aid material, and then designed for transport. But here you are more on a clinical side, and if you see at the end, there we have also medical equipment inside for monitoring the heart, for defibrillation in case your heart stops, that you can start that again. You can also put it on automatic mode, so if you do not have very high qualification, you could do it like in a shopping center. Sometimes you have AEDs hanging and every person can operate that, and these machines can be set to that automatic mode to take the fear of the operators away sometimes. Yeah, to make it automatic and you don't have to worry. And that's the specialty here. Ne? Space, medical equipment to take care, also for longer rides, because these are used in remote areas mainly, maybe not so much in the city, and there you have to cover larger distances and you have to attend to the patient. And then the nice box, and with air conditioning certainly in it. Limea, this is the second one Limea is getting. Okay. They ordered more, there are more coming. I think one is working somewhere on a pipeline project for ambulance services. But these are the first that we delivered. First delivered to Uganda.
Have you acquainted yourself with the emergency care system in this country?
Yes.
How have you found it?
Yeah, it's quite different because you have private organizations like Limea, which are really trying to be high-end, you know, and really a lot of medical care. We spoke to a lot of the MOH people also. They are also interested in this type of vehicle. They are looking on how to improve the system they have now, because it's very diverse. To put, you know, a standardization into the system, and also, and that's my biggest finding. It's very much taking care of the product. You know, that people take care of an ambulance. Somebody must be responsible to keep it clean, to keep it technically operational. That's important.
You're watching Health Garage.
This ambulance can work as an ALS, Advanced Life Support, or what you call the ICU, but it can also work as a basic life support. And what dictates what that is the equipment that you have on board and the personnel. Yeah, so we have this whole cabin, and then we have this area where we put our stretcher, and then on the stretcher we always have this resuscitation bag. This is a resuscitation bag that has airway support equipment. This is where we put this is our oxygen. So we have inbuilt oxygen that we can connect to the ventilator to give respiratory support. We have our monitor, which is a monitor but also a defibrillator. I'll just demonstrate this. These are, we call, it looks like an axe, it is an axe, but these are extraction kits. For example, if it's a road traffic accident, the windscreen is, the windows are up, someone is trapped in a vehicle, we can hit it with this and extract patients. Or if we need, if we're in the jungle and the field, we need to do anything that we need this for, we're able to do that. We also have an extinguisher on board, so it ensures the safety of everyone. Basically, in a nutshell, that's it about the ALS ambulance. So we're able to have the patient, the doctor, and the paramedic behind here. When we are evacuating a patient, we are able to communicate with our dispatch center that inputs this data into a record. Then when we hand over the patient, for example, if we are taking this patient to TMR, when we hand over the patient, yes, and it's the team on board documents everything they've done. I'll just show you a sample of how it looks. This is how it looks. So we document everything we've done, and when we are handing over, we are required to sign. We have whoever is handing over signs here, and the person.
You're watching Health Garage.
We need, or we request for support. One, from the users, the population, the people that need these services. The dispatch has a toll-free number, easily accessible, easily memorizable. Reach out, ask for help, and you'll get help. My second request goes to the, I don't know what the politicians, but the government. Empowering or providing support to such innovations, such steps for better healthcare by ensuring, equipment is availed, acquisition of equipment is not an area that is hindered by the government, but also support from the ministry in terms of recruiting such private providers into their agenda, because through them we can reach out to more people, and that's where I think Laimea should hold the banner for this. Emergency care is a neglected area in Uganda, yet a very important area that we need to improve. The biggest problem we have right now after HIV and AIDS and TB is road traffic accidents. They are claiming a lot of lives, and emergency care has to be improved to make sure we save all these victims of trauma, as well as improving the road safety. My last remarks would be, together we need to work towards a Uganda that embraces the 999 or 111, because we are far away from that Uganda. We need to have a centralized dispatch where all calls for emergency needs can go through and someone can receive the care they need. Yeah, without you having to call your relative or your what. If you can call a dispatch that can send you an ambulance that you need, that's the Uganda I look forward to in emergency care.
In conclusion, a robust emergency care system is crucial for improving outcomes and reducing mortality rates. The COVID-19 pandemic starkly highlighted the need for a well-structured, functional, and responsive emergency care system. While progress has been made, challenges persist in safely evacuating patients with time-sensitive conditions from communities and between healthcare facilities in Uganda. Thank you for joining us on this important discussion. Don't forget to subscribe to our channel for more insightful content on healthcare. Until next time, stay informed and stay safe.